CMS has put out their proposed changes to the rules for 2026, and it's kind of hard to talk about it now because sometimes it changes, but generally it doesn't. The proposed rule just becomes the rule. And one of the things that was put out before this administration took effect was changing how CMS pays for weight loss drugs. So here's the rule. And let's specifically go down to the verbiage. You can Google the CMS proposed rule for 2026 and read all this. But what it says is, traditionally, the Medicare Part D law, that's over 20 years old, specifically excluded drugs for weight loss only. Now they're saying, yeah, but we allow weight loss drugs if used for certain diseases, such as type 2 diabetes, cardiovascular risk. Now they're expanding that to say obesity is a disease. So if you are classified as obese, you should be able to get weight loss drugs covered through Medicare, through your prescription drug plan. That is going to be an expensive change, right? Because these obesity drugs retail for $1,000 or more per month. So what does that do if we have millions of people on Medicare now getting $1,000 a month drug? Well, that can also change in 2027 because Medicare is allowed now to negotiate drugs due to the Inflation Reduction Act. We will see the first fruits of that change in 2026. The first 10 drugs that are negotiated, Jardiance, Eliquis, Xarelto, you can see those drugs. Now the government has already started negotiations for 2027. And what is the first drug up there? Ozempic, Wegovy, Rybelsus, those drugs. So if that is negotiated, then the cost of those drugs will come way down. Oh, maybe it comes down 86%, like some of the drugs will come down for 2026. Maybe it comes down 20, 30%, like some of the drugs came down. But that remains to be seen, what the negotiation will yield. But this is a big change that could be rolled back, right? Anything can happen now because this was proposed under a different administration, and it's new days now. We have a new Health and Human Services Secretary. We have a new CMS director. We have a new administration with a new thought on obesity, thought on how much money to spend in Medicare. So this could be rolled back because it's too expensive. It could proceed. It could be expanded. You know, so you're like, well, why even tell me this? If you don't know for sure anything, we don't know anything for certain. Everything is the sands are always shifting. Right now, the rule as it stands is to get a weight loss drug, you must qualify, you must be prescribed it for type 2 diabetes or for a cardiac risk of stroke or heart attack. Obesity is not considered a disease that would be covered it, but if this law does go into effect and if the negotiations do proceed, boom, we could be looking at a whole different landscape for this country as far as obesity is concerned. So just letting you know what's out there. If you learned something, please give us a subscribe.